Well, with concerns over the Omicron variant on the rise, a suburban state lawmaker is hoping his new proposal will help convince the unvaccinated to get their shot.
Yeah, the plan would force unvaccinated Illinoisans to pay for their own health care expenses if they contract COVID-19. And WGN political reporter Taman Bradley is here with more on the controversy and how it works.
Yes, indeed. Ray and Lourdes, the sponsor of this bill, State Representative Jonathan Carroll, says he got the idea from his wife, who one day asked why government picks up the hospital bill for people who are unvaccinated.
I think it's our turn to shoot back and say, you know what? It's not our responsibility if you're choosing not to listen to the science and medicine of this.
Fed up with anti-vaxxers in Illinois, Democratic State Representative Jonathan Carroll wants unvaccinated residents to pay for their COVID-19 medical bills.
It's very frustrating that we're being asked, we're being asked to carry the burden of people that aren't following what the science and the doctors are telling us.
Carroll's bill would amend the state's insurance code so that a person who is eligible for a COVID-19 vaccine and chooses not to be vaccinated must pay for health care expenses out of pocket if the person becomes hospitalized because of COVID. The change would update insurance policies issued or renewed on or after January 2023. In effect, by doing this, you are putting in place a vaccine mandate. It's a requirement now that you get vaccinated. Otherwise, you'd have to pay if you got sick.
Well, I wouldn't call it a mandate. I would say that it's a personal choice. You have the choice still to get vaccinated or not. But if you take the risk of not getting vaccinated because the information that you've gotten from whatever source you get it from tells you that the vaccine isn't safe or this, that, the other thing, that's your choice.
The bill is almost certain to face legal questions. Federal laws bar employers and insurers from charging higher prices to people with pre-existing health conditions. But some employers are taking action anyway. Delta Airlines announced that unvaccinated workers could face a $200 monthly health insurance surcharge. Even without a legislative push, data show more and more Illinois residents are getting vaccinated. 56.9% of eligible residents are now fully vaxxed. In Cook and the Collar counties, more than 6 in 10 vaccine-eligible residents have gotten their shots. But in some parts of the state, the vaccine numbers are below 50%. In Cook County and Chicago, the message remains: get vaccinated or get the booster.
With cases rising and with a new variant out there, it's important that we ensure that everyone gets the vaccine.
The surest tool that we know to maximize safety is for people to get vaccinated.
We reached out to the Illinois Democratic House leadership about Representative Carroll's bill, and they declined to comment. Ray and Lourdes.
Does Carroll seem like he's unconcerned about any legal challenges that you mentioned?
He seems like he's willing to negotiate. He says this is a starting point, but he says he's tired of all the anti-vax noise and arguments that are out there. He wants the other side to sort of get aggressive and start to push from a government perspective.
A new way to approach this problem.